Hey guys, welcome back to another Dr. Shanté video. So this may be the third or fourth video that's COVID related or the coronavirus related that I'm doing. And this one is actually to provide information. Think of this as your virtual general consultation from your favorite pharmacist, right? So what I wanted to do is, as we start to learn that hospitals may be filling up and there's nowhere for people to go, and then there's some people, if you start to experience symptoms, you may not even want to go to the hospital. You may not be that severe that you need to go to the hospital, but you're still experiencing symptoms. What can you do? So we all know pretty much that it's the flu-like symptoms that you're thinking about, right? So let's just go over the flu-like symptoms and then what it is that we could do to treat them. And this is simple over-the-counter medication that you can access just by going to your local pharmacy. So we'll start with the first symptom, which is not the first symptom, but one of the symptoms. We're just going to start with fever. All right. So what can you take for fever? Pretty much the go-to is Tylenol. Okay. So you can do the Tylenol or Motrin. But if you have high blood pressure, we want to caution you to not do the Motrin and probably lean toward the Tylenol, okay? Mommies with your babies and your toddlers, the same two would work for them too, and you can even alternate it, all right? So what is a fever? A body temp for an adult, a body temperature that is 100.6 and greater, hopefully not, because that could be deadly. For children, 100.4. So it's really at that point where it's recommended that you would initiate something to help bring the body temperature down. And of course, we definitely want to make sure that we're staying hydrated during that time, because as your body temperature is rising, you don't know what is happening there, so you want to replenish those fluids and stay hydrated during that time too. So we talked about Tylenol and Motrin as being the products to help as fever reducers. The Tylenol or acetaminophen is dosed every 4 to 6 hours. The Motrin or the ibuprofen is dosed every 6 to 8 hours, both for adults and children alike, right? Sometimes, and I'm speaking more specifically with your children, when you're monitoring their fever, sometimes you may get just before 4 hours and maybe it's at 3 hours and you're taking the child's temperature and it's not coming down and you need to do something, but you gave them a dose of Tylenol. What you could do is give them a dose of the Motrin or the ibuprofen. And then maybe that'll help get you over into the next safe range to administer another dose of Tylenol if you need to. You just want to make sure you have a log and that you're keeping track of their temperatures. It's not until it gets to those higher numbers that they would even recommend that you start using the medication for the children. But it's totally up to you as the parent, okay? So that's for fever. It's also a pain reliever. So if there are any body aches going on with those flu symptoms, it's going to be helpful for that too. So the next thing that we're going to talk about is the sore throat, okay? You may experience a sore throat. I love this product called Cepacol, okay? And certainly you have a lot of choices out there, but this is my go-to for the sore throat. There's sore throat lozenges. And I'm actually pulling it up in my phone, my other phone, so that I can show you a picture of what that is. Here. This is the product, and I hope it's going into focus. These are the sore throat lozenges that are available, and it has an aesthetic in there, benzocaine. Now, it comes in the spray too, but be careful because they change the formulations with the spray and they may not have the same active ingredient inside of it. So you want to make sure that you see benzocaine on there, and that's why I showed you the picture of this product, because I know even though it comes in other flavors, I know for a fact that that one has the benzocaine in it, and it's just to help to numb with that. Something else you could do for that sore throat is gargling with salt water around the clock. It may not help so much with the relief of pain or numbing the back of the throat, but it can create a very undesirable and uncomfortable medium for bacteria or viruses to grow. So it can probably cut the duration that you're dealing with the sore throat down by taking it. Another product that I like is Coldeeze, okay? And this is kind of on the homeopathic side as well because of the type of zinc that is used. Do not go and buy zinc gluconate over the counter and start taking it in those high doses. You will throw them up. That is known. That's not what this is in the inside of in this product. It's slightly different. So even though the words kind of look the same, it's a little bit different, okay? So be careful not to do that with the Coldeeze. And that's a great product. As soon as those symptoms begin, you can start on those lozenges right away. And it's been very helpful with it. The next symptom that you may experience is a dry hacking cough. And a cough suppressant will work for this. My go-to recommendation for a cough suppressant, and it's a very aggressive dose, is the Delsum product, right? Now, it may say for children, right? But the cough suppressant in there, the dextromethorphan, comes at 30 milligrams, which is higher than most of the other over-the-counter cough suppressants. The Robitussin DM Max may come at 10 milligrams of it, maybe even 20 milligrams of it. But that Delsum comes as 30, and that's a cough suppressant. I like to use that one because it's a higher strength of it. Now, I'm not talking about Mucinex, right? And the reason we're not talking about Mucinex is because people who are experiencing it, they haven't talked about phlegm necessarily. Now, if you have phlegm in the chest, mucus in the chest, that will be the reason that you're leaning toward the Mucinex. Now, if you're noticing that you're having that phlegm in the chest, but you're not really having an irritating or uncomfortable cough, you can go with just the expectorant, which is that's in the blue box, okay? And that's to help clear up that mucus. Or you can go with the Mucinex DM product, which has both the expectorant and the cough suppressant, the dextromethorphan, inside of that product as well. And you can get a 1-2 punch with that, okay? Making sure that we're drinking lots of water. We're staying hydrated throughout all of these symptoms. Half your body's weight in fluid ounces of water each day. So we're gonna do that. But again, if you're not dealing with any mucus in the chest, X the product. That way you don't have to take something that you don't need. You don't have to have an additional drug for your body to clear out of the system. You don't have to deal with the expectorant. So if it's just a suppressant that you need, it's a dry hacking cough, nothing else, this is a great go-to product for adults to take. The next symptoms, I don't know if people are experiencing it, but in case you do have the rhinitis or the runny nose or the congestion, stuffy nose, you can go to the over-the-counter antihistamines, the Benadryl, Claritin, Zyrtec, Allegra. You pick your choice to help dry that up so that you don't have to, deal with that very nagging symptom. But I don't know that everyone is really experiencing that, because sometimes you may or may not experience that, one or both of them. But even in case that you had both the runny nose and the stuffy nose, then you can do the antihistamine combination with the nasal decongestant. And I pulled up just an example, something that you could use, right? It's going to be D with it. So this is just an example. Of course, it comes as Zyrtec D, Claritin D, Allegra D. They will be found inside of the pharmacy, because for the state you have to sign for the pseudoephedrine products. So even if it's an owl, maybe it's a little card or something you take to the pharmacy counter, and then they'll be able to get that for you. So if you don't need the decongestant, then you can just go with the single product without the D. If you do need it, then you have it. People with high blood pressure, you're not doing the D, all right? So if you have an issue with nasal congestion and you have high blood pressure, you're gonna go with Sudafed PE. So it has the decongestant that's better for that patient population. That's what it is that I'm trying to say there. So that's something that you can do. I wanted to mention too that with the sore throat, I don't remember if I mentioned that, about gargling with salt water around the clock. I don't remember if I did that, but I just want to say doing that too helps. Another thing that you could do to help with any congestion, stuffiness that you're experiencing at nighttime, if you have an oil diffuser, what I like to do is put these drops into that oil diffuser, okay? It's gonna come into focus in a bit. Eucalyptus. opens that right on up. I've done this for my son for as long as he's been, anytime he came into contact where he got sick or something, and it's very seldom that we're even sick, but anytime that happened, this was something amongst the other oils that I used to put into the oil diffuser, both for children and adults. We're also going to put a little bit of tea tree oil in there as well. And for relaxation, lavender. Okay, so I like to do the lavender and the tea tree together as just something for relaxation at night, even if I'm not sick. But if I'm sick or if I have some stuffiness going on, I'll go ahead and add the eucalyptus in there. Another thing that you could do for the dry hacking cough, lemons come into, those are great. I cut half a lemon. I cut a lemon in half, sorry, and now I have 2 halves. What I do is one of my little coffee mugs, fill that with warm water, hot water, kind of the level that you would get to a tea where it's comfortable. And I'm not saying that you're using a tea, I'm just saying that the water temperature that you would be using in this case. And you will squeeze all the contents of that lemon inside of that mug or container that you're using. It's gonna be a little sour. Drink it all. It does wonders as far as relieving a dry hacking cough. And on top of that, it clears mucus out of your body like no one's business, okay? So that's something that is going to be very helpful that you're doing when you're starting to feel those symptoms. Another thing that you could add to that, and I absolutely love this brand, honey. This is a brand of raw honey that I love, and I'll just leave it at that. You can put a couple teaspoons of that inside of that. And one thing that I like to say, when I used to teach clinical nutrition, the science of nutrition and diet, the years that I was teaching it, honey is a natural raw sugar. It's not a sugar substitute because it's actually fructose. It goes right into the cells and you can utilize it for energy. Okay, so you definitely, hey, we got to step up our raw honey game. It's going to be useful for us too. One of the last things I want to talk about is diet now. And we want a raw diet during this time. So if you can abstain from eating meats, dairy, processed foods, packaged foods, and just keep a very simple diet and give your digestive tract a break so that it doesn't have to work extra hard and consume energy that you need to preserve for your healing and breaking down the food that you're eating. And that's going to be a little bit weird because we're stuck in a house and we may be prone to eating more junk food now. So, but if you're feeling symptoms, cut that stuff out right away so that you can get yourself on a path to healing, okay? I have other videos that talk about the immune stimulants. I'll mention them briefly right now. As far as the herbs, elderberry, astragalus, echinacea. I have other videos that go into detail about the immune stimulants. The loading doses of vitamin C and vitamin D to help boost the immune system is also in another video that I have. I will be sure to drop those links below so that you can view them. Please do not become a vitamin junkie where you have all these different bottles of different vitamins. A multivitamin will suffice. Get them all. You need them all. And you're not choosing one or the other in what I'm saying. You're doing them all together, okay? And this is a very aggressive approach so that you have optimal results. That's what we're looking for, results, and we want you well. We go over the drugs first because we need to alleviate the symptoms. I've learned that when we can take away those symptoms, people are more likely to be compliant and consistent with the natural holistic therapies that you can do. And that's why this is an integrative approach with what I've given. And I hope this was helpful to you guys. Again, I'll link those videos. Please feel free to drop comments, questions, concerns below, and I'll see you all in the next video. Bye.